My name is Suzanne Johnson. I'm the International Manager for Africa, Haiti, and Ukraine with Chalice. The Kencan Medical Mission, which is Kenya, Canada, formed through a partnership with an organization in Prince Edward Island called Mikinduri Children of Hope, has three main priorities. The first is to partner with Kenyan medical practitioners so that there's a professional exchange, and we're continuing to develop skill set overseas. Each doctor is partnered with another doctor. Each nurse has got an assisting nurse, and it's all about building those relationships and learning from each other, sharing with one another. And we had the great fortune to partner with both Egerton University in Kenya and also the Kenyan Health Department.
We want you coming back here.
The second is obviously to provide services for those in need when we're on the mission overseas. And third is also to promote public health and public awareness. So when we're seeing patients and such, we provide public health briefings. We have a variety of healthcare practitioners, doctors, dentists, nurses, nutritionalists, and then we have also just volunteers that are coming to help either with logistics or administration or will be trained for the vision teams. We also have a series of pharmacists or pharmaceutical assistants that come. This mission we had 22 healthcare practitioners, and then we had a logistical team of about 5. So the mission started in the Great Rift Valley at our site in Gilgil at the Coulson Secondary Schools. From there we moved into the Meru region, into the town of Meru and the slum of Meru, and then into the rural villages of Kitimani, and then further out in the Meru region of Mikinduri. One of the great things about the mission is that often we come across situations where there's an immediate need requirement, and we have the flexibility within the mission to rapidly assess if we can be of service to a community. So during this last mission Mikinduri Children of Hope, while in transit, came across a refugee camp and decided to reach out to that camp and provide services. So that's a wonderful aspect of the mission, is that we can be flexible. Often we'll bring a smaller team into a slum region that will actually walk through the slums and provide immediate care for anyone that is identified in needing immediate assistance.
Open wide.
So during the mission we were providing dental care services. Dr. Bill Allen was the lead of our dental team, and we partnered with local dentists. Dr. Allen had previously gone on a mission and seen the need and identified that a portable dental kit would go to great lengths during this mission, and thanks to his kind generosity we had the full use of a full dental setup, and were able to pull over 877 teeth, which is about 25 man-days of dental extractions.
That's better? Okay.
The Vision team is a wonderful team. The Vision team is comprised of mostly volunteers. The Vision team works primarily to identify with the elderly that are having vision problems, and also those that may have chronic issues that require further attention. We brought over 14,000 pairs of glasses with us on this mission, and we're able to distribute over 3,000 pairs to patients. And then we train local people in how to also do the testing, and we leave pairs of glasses at each site so that they can continue to test their population, and if there's new people requiring that service, then they can continue to go. I think the wonderful thing about the mission is that it's a joint mission, so it's not just one-sided Canadians going over and providing services to Kenyans. We have a counterpart there. There were certainly our challenges, and at the end of the day we were certainly exhausted. It's early mornings and late nights, but when you see a child walk away feeling better and smiling, when you see an older lady with a new pair of glasses and she hasn't been able to see for the last 20 years, when you see a mother who's pregnant and needs to know whether or not she's doing everything she can to ensure the health of her newborn baby in the next few months, it really does provide spiritual growth.
Could you let all these children know that we think they are so beautiful?
So the mission is a volunteer mission, so all of our members are paying for their full airfare, accommodations, travel, and food while overseas, which is a wonderful gift that they're giving to the people during the mission. In the future, we're hoping to expand our missions, and we're looking to go into other countries and also to expand in Kenya. And so Chalice is going to be actively recruiting additional healthcare practitioners to assist and to join the team. But for our pharmaceutical and or the logistical costs, administrative costs of running the mission, Mikinduri Children of Hope fundraises throughout the year, and Chalice also provides funds. So we have donors and sponsors that contribute through the gift catalog to medical requirements or healthcare services through Chalice. You can go to Chalice website, which is www.chalice.ca, and there are links under how you can be involved to volunteer for the mission, or if you'd like to help in assisting raising funds for the mission, or you can call our Chalice number. When we come with a medical mission, it brings a lot of joy and hope to the community. to see a Canadian flag and a chalice of Mikinduri Children of Hope banner, foreigners that are coming from a place they may not even be able to recognize on a map, but that they're coming to help and that they're there. And there's no fees charged for the services that we provide. And if anything, they come just to see us. And in seeing and knowing, there's a greater sense of community that's developed. There's a greater sense that we are one people, that we are one community.
Oh.